This morning, the United States is facing a major healthcare problem. 6 in 10 healthcare workers, understandably, say they're burned out.
We're seeing extreme burnout and fatigue from our clinical staff and support staff.
We've had people literally walk off the job because they couldn't take it anymore.
The healthcare industry is in crisis. Record numbers of healthcare workers are burning out. For these workers, burnout has always been a problem, but the pandemic has made the issue significantly worse.
The worst part is that we were just consistently critically understaffed.
Some hospitals are so desperate to find nursing staff that they are willing to pay a $25,000 signing bonus.
In 2018, a large systemic review measuring the prevalence of burnout in physicians found that 20 to 40% of physicians were experiencing severe emotional exhaustion. And in 2021, that number increased to between 62 and 72% of all healthcare workers. Younger workers, particularly those at the beginning of their career, have been hit the hardest. This could be because younger people tend to work in the hospital settings, making them more likely to directly take care of a COVID-19 patient. But it also might be because novice healthcare workers take longer to complete tasks, and that novices need more brain power to complete routine tasks than veteran workers, as novices are not as accustomed to their work. This extra brain power that's needed could contribute to their burnout. People who work in emergency departments and intensive care units also experience higher rates of burnout compared to other hospital wards, as they have the most contact with COVID-19 patients. Now, a lot of these burned out workers are thinking of leaving their jobs. And many of these people are not just wanting to change employers, they're thinking of leaving the healthcare industry completely. This is similar to what we've seen in the Figure 1 community. When we polled our users, 71% were thinking of quitting their jobs, and 52% were considering leaving the healthcare industry completely. And we're already beginning to see the healthcare worker shortages today. So much so that some hospitals are calling code oranges, as there's just not enough staff to take care of the increasing number of patients. You can see it in social media as healthcare workers share the dire staffing conditions they face. Like this nurse who reported her ICU is short 7 nurses with no replacements. So, what are the signs of burnout? And how do we prevent healthcare workers from feeling it? Burnout is caused by significant stress in the workplace and is characterized and measured by 3 key factors: emotional exhaustion, depersonalization, and reduced professional accomplishment. Emotional exhaustion is the feeling of being extremely tired, like not having enough emotional energy to cope with the stresses of work. Depersonalization is the feeling of not caring about the job. You feel detached from your work, your coworkers, and your patients. Reduced professional accomplishment is the feeling that you're no longer competent at the job and that the quality of your work is poor. We asked some Figure 1 users to share their personal stories on burnout with us. Here's what they had to say.
I have experienced depression and fatigue because of this burnout.
One thing that I've experienced personally was I'd wake up to go to work and hate it, right? Absolutely resent the idea of having to go to work, to the point of almost hoping I would get a cold, or there would be a terrible traffic jam, or something would happen that I didn't have to go to work, because it was such an immense and overwhelming feeling of just anger and resentment, and even being angry with my coworkers or angry with other people that I've worked with, just because I was so overworked and burnt out.
Symptoms of burnout for me have been, overwhelming feelings of fatigue and resentment against people telling us about their health concerns, which is general feelings of just exhaustion and feeling incapable of making decisions because things just feel so overwhelming.
This is Chelsie Smith, a PhD candidate at the Sprott School of Business at Carleton University, and a winner of the 2021 Vanier Canada Graduate Scholarship for her research on employee mistreatment and mistreatment reporting.
So there are some signs of burnout that are rather less discussed than others. It could be this feeling of despair every time that you have to go into work, or even if you're being called into work constantly, a feeling of aversion and just that plummeting feeling that you have to go into work yet again, and you're not prepared to handle it. So when we're looking to recognize burnout in others, in our coworkers, that can manifest as making more mistakes than usual, or your coworker being a little shorter or just less engaged than they normally are. It might also take a lot more to get emotions out of them. We see a lot more blunted emotions.
Burnout is most often caused by the conditions of a workplace. Long shifts, large amounts of work, shortages in personal protective equipment, and workplace violence or abuse are all common factors contributing to burnout. And that lines up with what we found too. When we polled our Figure 1 users, the top 3 contributors to burnout for them were patient assignments, lack of resources like staffing and equipment, and work schedule. So how do we resolve burnout? Well, much of what has been written about burnout solutions tends to focus on teaching people how to cope with stress. To a certain extent, this is helpful. These techniques help make healthcare workers more resilient to sudden workplace stresses in the short term. But it doesn't really address the underlying issue, the environment they're working in that's causing them to burn out. Workers can only tread water for so long before drowning. It would be far better for everyone if they didn't have to swim at all. So I asked Chelsie what she thought some of the solutions could be to prevent burnout in the healthcare field.
So when we're thinking about solutions, we want to either decrease the demands on people at work, or we want to increase the resources that work gives them or supplies them. So having stuff be organized on the floor so people know where the PPE is, everything is tidy, supplies are fully stocked, and just making sure that the workplace itself is organized so people don't have to do a lot of walking, a lot of searching, a lot of extra physical effort, so they can retain as much energy as they can throughout their day. Having people give as much input into their scheduling as possible allows people to kind of plan their lives outside of work and to maximize their rest outside of work. And we have to remember that people are not only workers, they're people too. So they're parents, they're caregivers, they're humans with lives outside of work. I think that there are ways to help employees in their home lives that could help them mitigate burnout because they are able to have that recovery. Can we facilitate transportation for them? Can we get laundry services to help them just take care of the chores at home? Cleaning services as well. Is there any way to help improve their access to childcare or elder care services? So really just putting money into making sure that employees are not facing challenges at work and at home to really enable that recovery. I think that these solutions can look really costly, but when we think about the overall impact and how much we need these healthcare workers right now, I think that it's a really important investment.